many health benefits. On the other side, they are less effective when not used correctly, and the failure rate may reach up to 8 or 9%, and they require taking a pill every day. They don't provide protection against sexually transmitted diseases and HIV, and they have mild side effects and have some health risks as any drug. The health benefits of combined oral contraceptives include decreased amount of flow and fewer days of bleeding or even no bleeding. So this will increase hemoglobin concentration and prevent anemia. Regular predictable menstrual cycles, and so they can be used in heavy menstrual bleeding and in abnormal uterine bleeding. Reduced pain and cramps and no ovulation pain. Also, some immunologic diseases as rheumatoid arthritis are improved during intake of pills because they are steroids. Benign breast disease is improved, including fibroadenosis and fibrocystic disease. Acne is also improved by the recent anti-androgenic preparations, and the bone mineral density is maintained by estrogen. On the other hand, protection from risks of pregnancy, because pregnancy and labor are the main killers in the history of mankind. Also, combined pills prevent ovarian, epithelial, ovarian, endometrial, and colorectal cancer and symptomatic PID, as well as premenstrual syndrome and premenstrual dysphoric disorder. Also reduce the risks of functional ovarian cysts and iron deficiency anemia. Decrease the symptoms of endometriosis, including chronic pelvic pain, dysmenorrhea, and irregular bleeding. Improving the symptoms of polycystic ovary syndrome as irregular bleeding, acne, and hirsutism. With respect to the risks, combined pills have some risks like any drug. With respect to breast cancer, no overall increase in breast cancer risk for combined oral contraceptive use. The current use and use within the past 10 years is associated with very slight increase in risk. And this may be due to early diagnosis, which represents a detection bias, or accelerated growth of pre-existing tumors. And the recent studies indicate that there is no increase in breast cancer risk regardless of age, estrogen dose, ethnicity, family history of breast cancer. And some studies concluded that previous oral contraceptive use may be associated with a reduced risk of metastatic breast cancer later in life. And this is the relative risk of breast cancer among Cook users. There is a slight increase for current users, and the relative risk is 1.24. After stopping 1 to 4 years, it declines to 1.16, and then after 5 to 10 years, declines to nearly 1, and after 10 years, it becomes as the general population. With respect to relation to cancer, on the other side, combined pills are protective against ovarian, epithelial ovarian, endometrial, and colorectal cancer. Combined pills reduce ovarian and endometrial cancer by 50% or more, and colorectal cancer by 40%. And we all know that ovarian cancer is the most lethal cancer in the reproductive tract. Cock and cervical cancer. Cervical cancer is caused by certain types of human papilloma virus, the high-risk serotypes, and some increase in risk among women with HPV and others who use COX. So the causative organism must be present. Cervical cancer rates in women of reproductive age are generally low. And Cook users should follow the same cervical cancer screening schedule as other women, with the pap smear or HPV testing every 3 years, or the combination every 5 years. What about the risk of thromboembolism? COX may slightly increase the risk of blood clots, including DVT, pulmonary embolism, stroke, and heart attack. Risk is concentrated among women with additional risk factors as hypertension, diabetes, and smoking. We must look on the incidence of thromboembolism in the general population with combined pills and in the pregnant women. In the general population, the incidence is 4 to 5 per 100,000 woman years. And this increased twice or thrice in low-dose pills to 10 to 20 per 100 woman years, while pregnant women have 50 to 60 per 100 woman year increased risk. So low-dose pills increase thromboembolism, but not to the degree of pregnancy. Also, heart attack is slightly increased. The side effects of combined pills are mild and limited, including nausea, changes in the bleeding pattern, mood changes and headache, tender breasts, dizziness, and slight weight gain. These are the contraindications in WHO category 4. Correcting rumors and misconceptions around combined oral contraceptives. Combined oral contraceptives don't build up in a woman's body. Women don't need a rest from taking combined oral contraceptives. They can be used in extended manner or even continuously. Must be taken every day, whether or not a woman has sexual activity that day. Don't make women infertile. Fertility returns immediately after stoppage. They don't cause birth defects or multiple births, even if they are given during pregnancy inadvertently or when the woman gets pregnant while taking the pills. Don't change the woman's sexual behavior and don't collect in the body and don't disrupt an existing pregnancy. In summary, combined oral contraceptives are safe for almost all healthy women, and they are effective if used consistently and correctly with a failure rate less than 1%, and the fertility returns immediately without any delay. Screening and counseling for eligibility criteria are essential, and so combined oral contraceptives are considered as a blessing. Other forms of combined hormonal contraception include the injectables as cyclofem, given monthly, and the Mesigina or Mesocept, also given monthly. The last slide, other combined hormonal methods include vaginal ring as Nova ring, worn for 3 weeks and then removed for 1 week, and can be used also in an extended manner. And Anovera is a new ring which can be used for 1 year. Transdermal patch or Evra is placed on the buttocks, abdomen, or upper abdomen, and they are replaced every 3 weeks and can be used in an extended manner. Thank you for kind attendance and attention.